Thank you, Chair Weinstein, and thank you, Senator Kruger, Chair Kruger, members of the local government committee that are with us here today. Thank you for this opportunity. Thank you for all you've been doing during this awful pandemic that we've been faced collectively together as our governor continues to lead us through this very difficult time. Given the time constraints, I'll provide some brief remarks along with the written testimony which we submitted to the committees. You can find more detail on these and other issues of importance to the New York counties and to the city of New York. As we all know, that 2020 was a year unlike any in recent memory. Challenges posed by the global coronavirus pandemic pushed all levels of government to respond to new challenges and overcome unprecedented obstacles. Nowhere was this more true than for county governments, as the regional governments charged with public health, delivering health and human service functions. Counties were the primary point of response during the pandemic, launching emergency response centers, leading testing and tracing operations, managing and enforcing quarantines, substance abuse programs, mental health programs, and eventually leading the efforts to reopen the New York economy and delivering life-saving vaccines. These efforts were undertaken as we faced devastating local sales tax revenues during 2020. State budget cuts loomed, increased cost, and growing demands for social services programs. Now, as we begin the new year of recovery from the pandemic, local governments in our state are at a turning point. We have the experience, we have the expertise, and the trust within our communities to play a vital role in ending this pandemic, supporting the economic recovery, and getting life back to normal. But we need the continued partnership in our state government to work with us to provide the resources and the flexibility necessary to carry out this vital mission. Today, counties have two main requests for you and the New York State Legislature during these difficult times. Number one, because the federal government has provided a significant amount of healthcare funding through stimulus programs, we ask respectfully that you delay the county sales tax diversion that's being used to pay for what is called a distressed hospital fund. This distressed hospital fund has not been created yet, and the funding was intercepted by the state last month. Two, we respectfully ask you to restore the 5% across the board cuts that are presented in the governor's executive 22 budget. The state fiscal year 21 enacted budget amended the tax law 1261 to direct the Office of the State Comptroller to withhold or divert $250 million in local sales taxes, $50 million from the counties and $200 million from the city of New York, and place them into a new agency trust fund, a distressed provider assistance account, annually, temporarily for 2 years. Counties are requesting that you pause this initiative for at least this year and that you seriously consider eliminating it altogether. Significant federal funding has already been provided, billions of dollars to tens of billions of dollars is expected to be coming in the future out years as well for the hospital system. Earlier this month, the state withheld the $250 million in local sales taxes, but has provided to this date no definition of what a distressed facility is, nor have they provided a list of facilities in the city or around the state that would receive these local taxes, nor a timeline for these payments. Between the distressed hospitals and the AIM-related diversions that you heard about earlier from the 5 city mayors and the Conference of Mayors, nearly $500 million in local sales taxes now being diverted by the state to fill state budget holes or to pay for state programs where the state has eliminated or reduced their own fiscal support, such as the AIM program, as was reported by the New York Conference of Mayors. Counties recognize that the financial hardship currently being experienced by our hospital providers, but the revenue losses have been largely offset, as we know, by federal funds as part of the COVID-19 stimulus packages that were enacted in 2020. New York facilities and providers have already received about $11.5 billion. Again, New York health facilities and providers have received $11.5 billion in pandemic aid, rightfully so, to help cover higher costs and lost revenues. And they'll be receiving billions more thanks to United States Senator Chuck Schumer, Senator Gillibrand, and the New York delegation. The most recent payments will make up for at least 87% of lost revenue for all hospitals and providers through the second quarter, according to Senators Schumer and Gillibrand. More aid is expected to be in the upcoming President Biden's COVID response and recovery package. Counties, on the other hand, have received zero federal funds. They are struggling with mounting unbudgeted COVID-related costs, at the same time losing revenue due to the reduced economic activity that has come with fighting the coronavirus. The 57 counties outside the city of New York lost more than $720 million in sales and hotel occupancy taxes and gaming revenues. To make matters worse, the state is now proposing to level a 5% cut to counties as it scrambles to close its own multi-billion-dollar budget gap. These cuts translate to a loss of $160 million across the board and spare no program, social service programs, health and human service programs, and state reimbursement for programs counties already deliver and pay for. We ask that the final 22 budget restore the 5% cut to the counties, provided that the state receives a minimum of $6 billion in federal COVID-related funding. While I focused so far on areas of concern to the counties in the budget, I'd also like to note that the budget does include several provisions that the counties support, including granting permanent sales tax authority in parity with the city of New York, subject to local home rule actions in the community. 2, the county ability to apply sales tax to cannabis transactions should you authorize adult use cannabis. 3, expand investment options for local governments which need every tool in the toolbox to generate non-tax revenue. These options, again, are already available to the city of New York and have been for several years. Please extend them to other local governments in the state. 4, judgment interest rate reform. With prime interest rates consistently low for the past 10 years, the 9% judgment interest rate has done nothing but unfairly punish local government and taxpayers, and it borders on usury. 5, piggyback extension. Most counties have saved funds or gotten better deals by using bids led by other local governments across the state or even across the nation. We encourage you to extend this best value law for 2 more years. Lastly, I also want to make a note on the proposal in the governor's budget, which we asked for, to extend sales tax collection on vacation rental marketplace providers. This bill would require vacation rental marketplace providers to collect sales tax on the vacation rentals that they facilitate. The budget estimates it would generate approximately $9 million in 22 and $17 million in 2023. In the aggregate, counties would see similar increases as the state. We do respectfully request a modification to this language so that the sales tax is collected for the 57 counties outside of the city of New York to avoid any potential negative impact to the New York City economy. I also want to thank and commend the governor for including several other programs in the health and human services, in particular in the Medicaid program, and for continuing the Medicaid cap, which has saved local governments, the counties, and the local taxpayers billions in that program. We are eternally grateful for the governor and to the state legislature for continuing the Medicaid cap. Thank you for your attention. I'll be available to any questions that you might have.